Hello, I'm Dr. Xu Yi from Shanghai Six People's Hospital, Shanghai Jiao Tong University School of Medicine. I'm going to spend a little bit of time today talking to you about our recent JBJS article, Development and Validation of a Deep Learning Model to Predict Total Hip Replacement on Radiographs. The Total Hip Replacement Prediction, or the SREP model. The motivation to undertake the study was really simple. Studies have already been conducted to accurately predict the risk of total knee replacement, but methods for assessing risk of total hip replacement are still scarce. One of the primary challenges of the study was how to make accurate and reliable predictions. We did this by using the deep learning model. Deep learning has been widely applied across various fields of medicine, including, of course, orthopedics. After experimenting with various models, we ultimately selected the EfficientNet architecture, which is a lightweight, deep convolutional neural network model with fewer parameters and higher accuracy to predict the risk of total hip replacement. In terms of how practitioners should use this study to change their practice, I think the enhanced diagnostic capacity can assist clinicians in patient counseling and decision-making about the time of the intervention, which might have beneficial impacts on patients' care and healthcare. As with all studies, further questions are posed. I think one of the most important of these is the dataset size for training the deep learning model was limited. The case control cohort in our study consisted of 736 participants, and most people were white. Most had relatively higher levels of education, income, and medical insurance. This may prevent the generalization of the overall results to the general population. Indeed, we are launching a project to refine and validate the model using numerous prospective datasets before it can be incorporated into our routine clinical practice. Thank you, and I hope you enjoy this article.